So we're starting with Beth, Bethany, Jamie and Kuru. Sorry to keep you waiting. But over to you, and if you'd like to just sort of talk us through what you're presenting. Thank you.
Really come along. So this is us. We are third year medical students at Brighton and Sussex Medical School. I'm Beth, or Bethany. This is Jamie, Kuru and another Beth. We're just at the end of our third year at medical school, which is traditionally the hardest year of medical school. It's the first year we're kind of set out loose on the wards, we're set loose on patients, so we get the full experience, which is something that we haven't previously done. We've had like little tidbits, but nothing properly out there. So the patients are fully exposed to us. We're out on the wards, but we don't really have a role. We're there to learn, but we don't have a role within the team. We're not involved in direct patient care. We don't get involved in any decisions. We're just there. So this is kind of our stories of our time on the wards. We were lucky enough to be in the first SSC run by Munna, which was looking at kind of introducing comics as reflection into medical school. Previously it was all, well, it still is traditionally all written work, and we were the first people to kind of use drawing to do this. And we found it hugely beneficial. We had big group sessions where we all brought our comics and we could discuss them, and it brought out loads of common themes that we'd all had within the hospital. Feeling invisible, feeling very insecure, feeling inhuman because we have logbooks that we have to meticulously fill in by chasing doctors around and just getting signatures, which means that we don't interact with patients perhaps as well as we should because we're too busy trying to get these signatures. So this is just kind of our stories of time on the wards. Traditionally, comics have been used as the voice of the people that don't really get to voice their stuff that often, the political satires or geeks in America that want to draw superheroes. And as we're the bottom of the pack, we don't really have, like I said, we don't really have a role. So we're below the HCAs. We don't get involved in patient care, and the nurses, and we're definitely below the doctors, especially the consultants, especially in knowledge or just general decision making. So we just wanted to kind of bring that forward and show who we were really. So mine is called I'm 21 years old and I'm a third year medical student. And this is how we introduce ourselves to patients, or we were supposed to. It's I'm blah blah and I'm a third year medical student. This was drawn earlier in the year, so I'm 22 now, but just go with it. So this is me. This was drawn after a phone conversation with one of my friends who is obsessed with medical dramas, and she thinks that that's what my life is like now because I'm around in hospitals a lot. So she thinks it's people coming in with weird and wonderful injuries, sticking things in places they shouldn't be stuck, and beautiful, beautiful doctors that everyone's involved with. So we do get all of the blood, guts and the gore. We see all the surgeries, we take blood. Horrible, horrible things. For people that don't know, a teratoma is an ovarian cyst that's full of just horrible things. But we don't get all the glamorous stuff. We do the urine dips in peds, we take the blood, we run off with stool samples, etc. So it's not particularly glamorous. And we have a lot of stuff to learn, which isn't considered so much when we're on the wards by the people that we're following, because they think while we're there, we're shadowing, we have to be completely involved, and they don't put that much interest into the things that we're also doing outside, which is just a lot of lectures, learning, etc. And there's a long way to go. Like I said, there's a logbook, and then we've got OSCEs, which is actually at the end of this week, and then we've got CPDs and etc. etc. Before the holy grail of the foundation years, if we ever get there at the end. But then they also don't consider what else we see. As medical students, we see the whole spectrum of human life. I was on obstetrics in November, and I saw a couple of people being born, which was incredible. It was people starting their lives. And then I was on elderly medicine in January, and I saw people coming to the end of their lives, and I was there when someone was certified, and it was just very strange that at this young age that I've seen so much of people's lives that you just generally don't see. You're not exposed to that, like the cadavers upstairs in the anatomy lab. Normal people aren't exposed to that. We're just a bit weird, I think. So it's all pretty crazy, but it should be worth it in the end, I hope. So I'm going to pass on to Jamie now.
Thank you, Beth. Jamie.
Hi, I'm Jamie. I'm also a third year medical student. So I'm going to talk today about my story called Outpatients. It's an autobiographical comic about one of my early experiences in the medical outpatients departments. So we sit in at the back of medical outpatients and observe the clinician, always eager to learn from them, to hear about patients' experiences, and just to hear about patients' medical conditions. So this is just me sat at the back of the room and observing the clinician. As time goes on, the medical student at the back of the room is usually forgotten. Similar structure every time I go to outpatients. I will sit at the back of the room, try to ask questions, try to get involved, but usually sometimes just get ignored and told that the consultant is just too busy today to talk to me, but I'm more than welcome to stay if I want. So I just tend to blend into the background until it's time to end the clinic and get my logbook signed off. So I use comics to explore life as a medical student and how days in the hospital look through inexperienced eyes. Emotions are hard to express as a student, and I think comics are one of the best way to do these. And using this comic, I've explored the feeling of being invisible, and just the frustration of having to do this just day in, day out, like 2 or 3 times a week, and it just still being exactly the same experience. And as Beth said, our preclinical years mean we don't have that much experience in the hospital, so our patient care is limited. But I just wonder if we were actually noticed in the background, and I wonder if anyone would notice if we actually just disappeared. Thank you.
Hiya.
Which one is the left button?
Sorry about that. Hi, my name is Kuru. My actual full name is, my name is Kuru from Malin. I'm a third year medical student here at Brighton Sussex Medical School. That's what we have to say every single time. So my comic today is about, I'm just underlined 3 times, a third year medical student. So I never really actually, I read a lot of manga, Japanese thing, as you can see, Asian. I'm not Japanese, but like, I always loved like reading stuff, but I've never actually thought about drawing comics myself. And you know, Dr. Al-Jawad just gave like this fantastic SSC, which I thought I have to do that. So basically, this is the comic I have got out of it. Starts off with a typical day in a hospital, and the F1 is foundation doctor. If you don't know, he's the junior doctor, just passed medical school, and he goes, "So who are you?" to me, and I'm just in my head going, "Okay, just calm. I'm just a third year medical student." Notice the just. And I go, he goes, "Okay, you know, nothing else is expected of me." And I go, "Saved, I'm fine." And then the next day, the nurse asks me, she thinks I'm a doctor. That's amazing though. That's an amazing feeling, trust me. Are you looking after this patient? Sorry, just a third year medical student. She goes, "Okay, that's all right." She doesn't know anything. I'm like, "Don't know anything." The patient thinks I'm a doctor. Doctor, what's happening?" I'm like, "Sorry, just a third year medical student." So that's my days basically, and then comes the consultant. Right. Before he even asks anything, I go, "I'm just a third year medical student. Please don't ask me anything. Please don't ask me anything. Please don't ask me anything." So just a third year medical student, he goes to me, "What do you think is going on with the patient? What will you do?" And that's you. In my head, I've got this. I don't know. What did the patient say? What was the patient? What is he? What's going on? And I just take too long. And basically he goes, "Third year medical student, you should know these things." And I just go, "Sorry, I'm sorry, I don't know." And in my head I'm just going, I feel so dumb. So dumb. So this is my original script that I drew. First, like, this SSC was like kind of like I think the first SSC right at the beginning of our third year. And when you go in, like when I drew this comic, like I actually found myself saying, you know, you don't go, "I'm a third year medical student." You actually just go, "I'm just a third year medical student, please. Like it was like my shield, you know what I mean? I just kind of put that out there so they go, look, I really don't know anything. And then as it went on, like the doctors always went like the specialist doctor in their own kind of, if they're neurologist or in elderly medicine, they know everything basically, and then they expect you to know everything when you go in as a third year medical student, and like it really makes you like feel very incompetent and that you don't know anything, and it's very downheartening. Like when you have these kind of episodes all the time, every day in hospital, because you can't be of use to anyone. You go to the nurse and you're like, oh, okay, right, cool, and you just get fine, that's fine. And the doctor's like, that's fine, do that next. And actually, patients are actually much nicer. They go, okay, they still think I'm a doctor, so it's good. So like while I was drawing this, it actually came about, the fact that I was using this phrase a lot, and it made me like once I drew this, I was just like, yeah, I am a third year medical student, but you know what I should be doing with this? I should be going, yeah, I'm a third year medical student. I need experience. Give it to me. So I think after I kind of just went like, don't think negatively. This experience, take it. You're a third year medical student. Move on and just kind of understand that you won't know anything. You will be incompetent. You won't know a lot of stuff. You won't be of help to a lot of people. But try and do as much as you can when you're there. So that's what I got out of this comics, and it was absolutely great fun. So I hope you enjoyed my comic. Yeah.
Okay. So I'm Beth as well. My comic's called How Sensitive, and if anyone's ever had to do a medical reflection essay, then that's the Kolb cycle. It's how you're supposed to structure a clinical reflective essay, and we get it drilled into us from sort of day one, year one, and it's painfully familiar to us probably. And mine's sort of about how difficult I find reflection and summative portfolios as a means of assessing how well you can reflect on your practice. So sometimes I feel as though I'm one step behind how I should feel. And I hadn't noticed that I put the word should in there, which actually in itself is quite telling. Callous. I had an experience on the elderly ward where I was so desperately trying to find a mini text to present to the consultant the next day that I didn't notice the patient I was talking to starting to cry. And after I'd stopped and held her hands and thought, God, how insensitive of me, thought popped into the back of my head, oh, this would be a really good portfolio. And I just thought, how? I'm always assessing how I should be feeling and coming across. It's almost like when she started to cry, you go straight into, oh, this is breaking bad news scenario. I've been prepared for this as a role play. I know how to, okay, stop, hold the hands, get the tissue box. And it's almost like there's a depersonalised or something. It's just there's a barrier there that it wouldn't normally be if your mum started to cry or something. And just always trying to reflect the continual systematic reflection that tomorrow's doctors are meant to do, to the point where the patient's pain becomes beneficial to me. That's me catching her tears from cashing in on my portfolio. And yeah, I have it circling back round like a true Kolb cycle, because it's not something that I've really resolved. I don't really know how to get around having summative portfolios, because as we all have a non-compulsory portfolio this year, which means that I don't think anyone's done anything for it. So I think you have to have it compulsory, and having it formative rather than summative probably means people don't put as much effort into it, because everyone's desperately trying to get into the top decile to get a good job or whatever. But there's something that just doesn't ring true to me about I'm getting praise in being sensitive enough to realise how insensitive I've been, and it's not something I've really come around to. So brings us to why do we need to reflect in medicine? What is reflection? Self-reflection is just the cornerstone of safe medical practice. You have to recognise limitations within yourself, within the system that you work in, and try to improve them for safe future care. And as I said, it's a GMC requirement, so it's brought in early in medical schools now. And it's unsurprisingly, it's not that popular, because people don't like having to try and put into words how something's made them feel. People find it really hard. And they don't like being marked on how well they've been reflecting, because if you really tried on something and it's just not the way that your assessor likes to mark it, or whatever, I think it discourages some people. So how can comics help us? If someone finds it hard to put into words how something's made them feel, comics just provide a completely alternative, easy and engaging way to just, you open up that person's mind to someone else's scrutiny, really. Drawing the comic in itself is essentially reflexive. You have to recognise how something's made you feel in order to draw a picture of it. Or sometimes, I think as we all found, once you've drawn the picture, you realise how something's made you feel, or you didn't even realise that you were angry about something until the end of it, and you think back and say, oh, okay. It's a bit disturbing what I've just drawn. Because it's not constrained by flowery prose or a long essay, you can get even the most chaotic thought down onto a piece of paper, and someone else can see it and understand your chaotic thought without having to try and get it into words. And having the fun or childish visual content makes it easier to talk about difficult issues. There's something about the sort of juxtaposition that makes it, you can talk about death and it's not as heavy as reading an essay about death. So our conclusions, I think, that we found our voice, the lost voice, we found our voice in comics, and a way to word our anger and our humour and the voice, the inhumanity and the humanity that we see sort of day in, day out, and all the unfair hierarchies throughout the most terrifying year of med school. And we all really enjoyed the SLC, and we wanted to thank Mina for giving us the opportunity and opening our eyes to a new way of reflecting. So thank you.
Thank you.